The CPS are currently considering whether Southern Health, which was the service that cared for Connor, should be charged with corporate manslaughter. What do you think is the appropriate punishment for these never events?
The Corporate Manslaughter Act was brought in a couple of years ago, and in the context of healthcare hasn't been sufficiently used. When there's a genuinely corporate failure to protect people, to provide reasonable protection to people in whose care that organisation should be responsible for, it's a wholly appropriate thing to do to investigate whether a prosecution, a criminal prosecution under the Corporate Manslaughter Act can be brought. That, I think, would send a very, very clear message, in addition to all the messages about good practice and appealing to, of course, what will be the main motivation for people providing care services, is the vast majority of them want to do a good job. But it's sometimes management that get in the wrong way, particularly when we've got fragmented services and many of the service providers are driven by a profit motive. It's really important that those corporate bodies know that they can be held to account if they fail lamentably in safeguarding the people they're responsible for. Another new development, of course, is the government has said that it's going to bring in a new offence of willful neglect. And that, I think, also we have to say, in these extreme cases of neglect, will be a useful thing to ensure accountability, and even more importantly, to hopefully make it less likely that the neglect happens in the first place.
Is it possible to ensure that tragedies like Connor's don't happen again in the future?
Sadly, it's probably never going to be possible, dealing with the number of people that health and social care services do, and all the variable circumstances, that avoidable tragedies will be completely scrubbed out and made literally never events. But with dedication, commitment and resources, we should at the very least make them as near as, damn it, never events.
In your role here at AFMA, do you feel frustration that systems and processes seemingly obstruct obvious improvements and sensible change?
Yes, the vast majority of people working in health and social care are incredibly committed people who've come into that service because they want to help other people and are true professionals. Of course, you'll get the occasional miscreant health professional, as you do in any profession. However, in our experience, it's usually systems that get in the way of good quality and safe care. A number of factors in recent times have, if anything, contributed to the risk of system failures. Amongst them, I'd list constant change and reform. The fragmentation of services, making the system more complex. As a very, very simple concept, we believe, and most experts in risk management agree, that the more complex you make something, the more fragmented you make it, the number of different organisations, for example, who are brought in to providing care, the more you're increasing risk. And sadly, that's just what we've seen. We would also suggest that where care provision is driven primarily by organisations with a profit motive, there's a clear risk that requirement to deliver a certain profit will lead to corners being cost. Now, I'm not suggesting for one moment that it's not possible for private providers to provide a perfectly good quality and safe environment, but it does add in that risk factor. Most of all, perhaps in systems not listening to service users, their families, and even to the staff is a recurrent problem. So in very many of the cases that we have dealt with, someone has tried to raise the alarm, be it the service user, the patient, their family, and even staff. So health and social care professionals are not being listened to, and if they make too much of a noise, they're treated as whistleblowers. That's a situation that no health or social care professional should be forced into. They should be able to raise concerns and get them dealt with before it becomes an employment dispute.
In the light of the Francis report, what would you say are the ingredients for the culture change that's needed?
I'd say there's two big cultural changes that we are hopeful will come about in the wake of the Francis report. One we're already beginning to see emerge in the form of a statutory duty of candour. That's a statutory duty on all care providers to be open and honest when something has gone wrong, so that justice and fairness can be done by the patient or their family, but also so that there can be learning, because of course if you're not owning up to things having gone wrong, there won't be the learning to make things safer for other people. The duty of candour is a start. It for the very first time, amazingly, is saying that it's an absolute requirement to be open and honest in these circumstances. I think in years to come people will scratch their heads that for the whole history of the NHS up to this point, nobody has been breaking any statutory rule or law if they cover up after an avoidable accident that's caused harm. So that's a big step in the right direction. But we need training and we need support for staff also to enable them to live up to the expectations of this duty of candour. We need training and support, protection for staff in doing the right thing, in raising concerns so that they're heard and their concerns are acted upon and they're not scapegoated as so-called whistleblowers. The other big area that we want to see change and real cultural change in, again, we're hopeful we're beginning to see the start of that change, is a more robust and effective regulatory system. It has to be said that the Care Quality Commission, up to very recently, and its predecessors, have not lived up to the expectations that have been laid at their door about being an effective regulator. We think that in the wake of the Francis report and also a new management at the Care Quality Commission, there appears to be a new culture, a new willingness to engage with patients, service users, carers and their representatives, patients' bodies like ourselves, to make the system more robust, to have an inspection regime that's more likely to pick up on problems and to take really tough regulatory action proactively where those concerns become apparent to them. We obviously hope that that optimism is fulfilled in the course of time, but things seem to be moving in the right direction.
One of the things that Connor's family is calling for is an effective demonstration by the NHS that it's making provision for learning disabled people a complete and integral part of the health and care services it provides. How do you think it might do that?
I think the NHS could be doing more to set out its agenda regarding people with learning disabilities. 2005 was when we saw that report from the National Patient Safety Agency. We have not as yet had a convincing strategy published about what the NHS is going to do, and social care providers as well for that matter, to ensure the safety, to deal with the issues that were known back in 2005 were occurring, putting people at risk who have learning disabilities. So a very high profile statement, if you like, about their agenda, their programme for improving safety in the field of learning disabilities and the resources to back that up would be a big step in the right direction.
Finally, Connor's case is a tragic demonstration that society's most vulnerable people are being failed by the mechanisms that are in place to safeguard them. Is there any messages that you can think that, or any actions that you think what needs to be changed?
When something goes tragically wrong, as sadly it clearly did in Connor's case. It's really, really important that whilst Connor can't be brought back, and the other people whose cases we've dealt with that have resulted in death can't be brought back, it's really imperative that there is learning from that tragedy. Families, and families like Connor's in particular, make an amazing difference. But it shouldn't be so hard for them. They shouldn't have to make so much noise. So the system has to be more responsive. The system shouldn't need to be dragged, kicking and screaming, to the door of taking action to improve safety. And that's the kind of approach we'd like to see in the future.